Normally, we would start with announcements. Instead, I'm going to start with a poll, and then I'll go into my quick announcements. So, because we'll send the poll out, and then we will get the results. So, my questions for you is, what is compliance? And whenever I start something with what is, I always want to, I feel like I'm in an A1 commercial, where and hang on a second, the poll has actually popped up for me too, so I'm just going to vote here.
Oh, it may not let you because you're a presenter.
Okay, so it's not an A1 steak sauce question. Is compliance doing what's right? Is compliance doing whatever the government says? Is compliance doing what's legal? Or something else that I haven't thought of? And those numbers should be popping up on or the option to vote on your screen. Just choose the one. You can only choose one, unfortunately. You can't pick more than one. So I guess if you wanted to pick more than one, it would be something else I haven't thought of. Not many announcements as usual, but October 18th is our next webinar, and that's going to be Health Law 101. It's sort of designed for sort of three sets of people. First, if you've got a lawyer who just started recently or is coming into your organization from another job and you want them to learn sort of the basics of health law, this is perfect. If you're not a lawyer and you kind of want to understand some of the basics of like, what is Stark? What is the anti-kickback statute and the like, fee splitting? And then finally, if you've been doing this stuff for a while, but you kind of like hearing, you feel like you could use a plain text explanation of Stark or the anti-kickback statute, this session will be designed to go through things in just plain English. Here's the law, but here's practically what you need to take out of it on the basics of Stark, the anti-kickback statute, fee splitting. I'm forgetting a few others, a little bit of basic pricing. In November, on the 8th, Katie Ilton, Briar Andreessen, and Marguerite Amann are going to do HIPAA breaches. And I know just in the last 2 days, I've had 2 clients that had emails go out to broad groups of people. They'll be talking about that and other stuff. So I'm hoping to see we have the poll results coming, Robert.
Yes. I'm going to get them to this moment.
So I guess I will wait. We'll start. So I'm going to go ahead and just tell you kind of my answer to this. People tend to think that compliance is doing what is right. And here come the poll results. I'll pause for one moment. As we fill this dead air, this is what's not supposed to ever happen on radio. So I think maybe one of the lessons here is don't do polls. So here's what we found. 45% of people think doing compliance is doing what's right. 10% think it's doing what the government says. 43% think it's doing what's legal, with 3% something else I haven't thought of. So we kind of got a plural or a split between doing what's right and doing what's legal. And I'm happy to see so many people say doing what's legal. Here's my answer, and here's why. I get why people say compliance is doing what's right. There's something about that that feels ethical and compelling. Let me ask you a question. You've been overpaid. You want to refund the money to the government, and you're trying to figure out how far back to go. What's the right answer on that question? If you're just thinking morals and ethics. And I don't know that there is one, right? I don't think you can find it there, which is why compliance isn't doing what's right. Obviously, in my mind, compliance is not doing whatever the government says. If it was, we wouldn't have a court system, right? We'd be in a dictatorship, and whatever the government said, you just do. So to me, that's one to throw out. Compliance really is doing what's legal. And I think that that's an important thing for people to understand. There's an ethical part of stuff. You want to do things morally as well. But the core question here is what's legal? And part of compliance, I think, is getting everyone in the organization to understand the importance of the regulatory elements of what we do. It isn't unethical or inappropriate to try to figure out what the law is. And in fact, many times we can't answer questions without doing that. You may have the eagle staring at you. I saw this on my way into work. Maybe one session will do nothing but pictures of things I've seen on my way into work, like the pelicans last week. The eagle can stare all he or she wants as the federal government. You don't have to do whatever the government says. So just a very quick thought on what's going to get you on TV, and I think almost everyone listening knows that. Relationships between doctors and hospitals or between physician groups and healthcare professionals and facilities and drug and device companies is near the top of the list. It's probably tied with coding problems as things that will get you on TV. Actually, no, those are things that will get you in trouble. I think things that will get you on TV, number one, might be confidentiality snafus, which is why Katie Breyer and Margie will cover that November 8th. Anytime you keep something that isn't yours, it's likely to get you in trouble. Lying in interaction with the government. And then we have been so busy with stupid, innocent Stark problems. The lease amendment you don't sign, the extra space that a clinic takes in a hospital that doesn't get memorialized, that kind of stuff will get you on TV. So how do you approach compliance? Well, the key thing is that the system has to be fair. And I'm a big fan of the everything you need to know you learned in kindergarten approach to this, which is that you should only seek reimbursement for things you actually did. If you didn't do it, refund the money. But if you did it, there should be a presumption that you get to keep the money. And you only don't get to keep the money if there's a really clear rule that prohibits it. Now, rules and policies are a totally different ball of wax, right? What we as a lawyer, I think makes Fredrikson, we're proud as Fredrikson to try to keep people from refunding money when they don't need to. And we'll talk a little bit about that periodically here. But it's important to recognize that just because someone has a policy that a MAC says something or an insurance company says something doesn't mean it's valid. And so just because you see something in writing doesn't mean you need to follow it. Obviously, not all payers are created equal. You don't have to follow Medicare rules for private payers. When you're dealing with a private insurer, if their contract doesn't clearly prohibit it, then the only other thing you need to worry about are industry norms. If you don't have a contract with them, then the only thing you need to worry about are industry norms. You don't need to follow Medicare rules for other payers, and you don't need to treat everyone the same. And people often think if you treat different patients differently, that's discrimination. I guess on some level, it is discrimination. It just isn't illegal discrimination. And this is another important point that we need to stress to folks, because people think anytime you discriminate, you're breaking the law. But it is legal to discriminate. We do it all the time. You hire the smartest people. You get the best, right? Medicaid and Medicare treat preventive medicine differently. You can't treat a Medicare patient the same way you would treat a Medicaid patient in many states. You literally, to follow the rules, have to treat them differently. And that's A, practically very difficult, and B, really counterintuitive to a lot of people who think it feels unjust. One of the themes that's going to be running through this talk today is how misperceptions often get people into trouble. People think they're breaking the law when they're not, and that often is the source of compliance conundrums. So our job is to separate the fact from fiction. And I've used this slide for almost 20 years now, so I apologize for people who have seen it before. But it's so true that conventional wisdom or knee-jerk reactions often get a life of their own. Many lawyers think that the way to find out what the law is you pick up the phone and call someone at CMS. That is not finding out what the law is. It may be finding out what the government's enforcement position is, and I don't want to minimize that, right? A practical client may say, I don't care if this is legal. If the government's going to attack me, I'm not going to do it. That's fine. That's Zen. But you want to know the difference, right? And I got a call a few weeks ago from a client that had refunded $1 million for some short stay hospital stuff. And then they heard me give a talk and they're like, oh, David, now we think we don't need to have done that. Did we need to refund that money? And my answer was no, but they've refunded it already. Now, I think we might actually have an argument to make to try to get the money back. But this is a personal plea. If you're doing a refund of any sort of substantial money, and by substantial, I think I'm talking, in the 4 digits or 5 digits, think about picking up the phone and calling us first. Because in a 15-minute phone call or a 10-minute phone call, which is, we're talking about something that's going to cost you under $100, we might be able to say, you don't need to refund that money. They're some of our favorite phone calls, and there's nothing more rewarding as a lawyer than saying, no, you get to keep the money for the work you've already done. So I really want to drive that home. The questions we're going to ask is something a requirement or is it a guideline, right? With Medicare, you start at the Constitution. and you work your way down. The fact that something appears in writing isn't binding, and it gets even weirder. Like you've got a national coverage decision. You think, oh, we're not inconsistent with the national coverage decision, we need to throw this out. Well, it turns out that unless a national coverage decision explicitly prohibits coverage, it doesn't limit it in any way. And so whenever you have an NCD that says it's covered in the following 5 situations, you might think if you have a 6th situation, you're out of luck. That's not true. That's not well known, but it's not true. And the source for that is the introduction to the National Coverage Decision Manual, right? So there's another one. We've had situations where clients have said, oh gosh, what we did wasn't listed in the NCD. We need to refund the money. If you called us first, you don't. Now, private payers, it's much harder to figure out what's going on. You got to slog through the contract. They probably have manuals that are incorporated in the contract, but always ask for someone to give you a copy of the rule in writing and get that to counsel. Then it's counsel's job to explain whether or not what someone thinks is the rule really is. Often rules aren't properly promulgated. There's been some high-profile litigation. Back in the 90s, there was an investigational device case, and there was language in the Medicare manuals, and there was a real question as to about whether that manual language was valid. Just because someone sounds smart doesn't mean they're right. Our son is a big fan of KCD comics. I find many of them very funny. Some of them are a little weird. I won't read this one out loud. You can slog your way through this one. But this one did make me laugh. This is a very smart-sounding person who's just making everything up. And that happens a lot in the world. Plus, I will tell you, I know I get stuff wrong a lot. I learn about a new Medicare rule almost weekly. So I could be saying something in here that's totally wrong. And if you think I am, speak up, challenge me, and then I need to prove the rightness of my position. Always remember, however, that in a fight as to whether something is legal or illegal, the burden is on the person who says it's illegal, right? This is America. Something is legal unless the law explicitly bans it. I'll pause to say, I know people are sending in questions. Please do that. You can do that in the chat box, and we will probably pause on our way through to answer some of them. So occasionally when I'm talking to a client, they say, well, we know everyone does this. And they view that as a comfort. And I don't like that as a comfort at all, because if everyone is doing something that's illegal, the government can pick on that and nail everyone all at once. So actually, I think one of the highest risk activities is something you're doing that is illegal and popular, right? Those scare me. The government is perfectly happy to use either dumb or non-existent rules to get money. I think part of your risk management strategy is getting patients on your side. If people can pick between you as a healthcare organization and their insurance company or the federal government, they'll often pick you. And so it's really helpful to take time to explain what's going on. Now, when it comes to compliance plans, I am a fan of the big picture rather than the details, right? I should note, they have promised back in the Affordable Care Act, there was the promise that compliance plans were going to become mandatory. With the exception of skilled nursing facilities, that hasn't happened yet. There isn't any requirement that you have them. They're just smart. The way a compliance plan gets tested is it's a Thursday night and a guy or gal with short hair and a Crown Victoria shows up in your front yard and says, hey, what has blank done to comply with the law? And that means it's not about your book. It's not about how many policies you've written. It's whether your employees think you're a good organization or not. It's making sure your employees know that they can raise an issue internally and that it'll get handled. We'll talk more about this. I like encouraging people to use not just a hotline, but a Gmail as a mechanism to send an anonymous note. There are some downsides to that, and we'll come to those in a bit. So this is an attitude and a philosophy. It's not paper. It's not process. It's having employees know that they can ask questions and that they have a duty to ask questions, and that the organization has a duty to answer their questions. That means that if someone calls the hotline, they need to know whether, if they leave, assuming they leave their name and number, they need to find out what the answer is. And I think people sometimes worry about confidentiality and can we share the results with the person who brought the complaint? I personally err on the side of having the answer to that be yes, because I think if you do that, it makes people more likely to continue to bring questions your way. And so I generally err on including people. It's not like that there's a legal requirement that you do that. And you certainly do have to worry at times about defamation and things like that. But I'm going to bend over backwards to let someone know, yes, their concern was valid, or no, it wasn't, and here's why. It's probably most important when their concern isn't valid, because they're going to continue to have the worry unless you can explain to them why they shouldn't. If you're looking for sources of information, I won't spend long on this. MAC bulletins, the government loves to tell you in bulletins what's going on because they can always put it in front of you and say, did you see this? And then there's no good answer for you other than yes. If you say yes, and you're breaking the rule that's in there, they've just shown that you were aware of the rule. And if you say no, they've kind of got reckless disregard. So those bulletins are great. You know, you can get, our webinars are free. I hope you know this. Our past webinars, we're going to be going into year 12. Can't believe that soon. We've got, I think, 6 years worth of webinars up on the web. You can go look at those. Government websites, trade groups, magazines, and the OIG work plan. So there are 7 elements of a compliance plan. I'll hum through those pretty quickly right now. I like number 3, which is avoid giving responsibility to people with a propensity to engage in illegal activities. That always makes me laugh. I'm not a big fan of writing lots of policies. And the reason I don't like policies is that I think organizations, no one reads them, right? You have them, no one looks at them. And the government likes to use your failure to follow a policy as a legal violation. It shouldn't, it isn't, but they do. So I keep policies to a minimum, but, and we're going to talk at the end of this about the University of Utah and their situation with Alex Wubels, their nurse. There was a situation where policy was super duper helpful, all right? Policies can be good, and where I believe policies are most useful are where things are counterintuitive. If you're trying to explain something people won't understand, there you might as well write it up because it increases the odds that the thing people don't understand, they'll know about. Then it becomes how to write the policy. And this is where talk about should a lot as opposed to musts. And well, this is going to be a theme we're going to come back to. In the compliance world, you often want to say you must do this because there's a belief if you tell people they should do it, it doesn't have enough teeth. And I don't agree with that principle. We'll come back to that in a bit. So as we discussed, you have to avoid giving responsibility to people with a propensity to engage in illegal activity. Hopefully everyone is doing background checks. Now, one of the questions is how often do you have to do those or recheck the OIG exclusion list? The government has said they want people checking that list monthly. Personally, I think that is insane. If you check it at least annually, ideally semi-annually, we've had situations where the OIG came in and said, hey, this person's on the list and you didn't know about it, you owe the money back. And we've convinced the OIG that if the list was checked and the person wasn't on the list when checked, that there's sort of a reasonable amount of time that goes by where you're without fault. And that if the government puts someone on the list, they should tell you that they've put the person on the list. And we've gotten the OIG to go away in some situations where that has happened. I'm a fan of background checks, but something I didn't know about them, they're kind of crummy. So we had a situation where a care provider, in this case it was a CRNA, rumor had it that this person had had a criminal sexual abuse conviction, which, you know, understandably caused some concern. So our charge was to find out whether it was true. The only way to confirm it proved to be if you knew the county in which the conviction had occurred. Just the standard little background check for this person came back clean. I hadn't realized that when I did it. It was kind of a lesson for me. There was like a $4 background check you could get from the Minnesota Bureau of Criminal Apprehension, but it wasn't that good. So just keep that in mind. Use compliance as a factor in employee evaluations in 2 different ways. One, if someone isn't very compliant, you need to deal with them. But the bigger thing is, you should ask every employee as part of their review to give feedback on the compliance plan. What's working, what's not, who do they feel comfortable talking to and who not. We've had dozens of situations where a problem popped up and a mid-level person failed to address it. We'll come back to that in a bit. So I'm a big Far Side fan. I'll have a few Far Sides. Listen, we're George and Harriet Miller. We just dropped it in the Pigs for Coffee. We're coming out. We don't want trouble. In the compliance world, you get judged by the company you keep. If you're in with the pigs, the government's going to attribute the pig's behavior to you. You can't hang on to the physician who's the number one utilizer of a service that everyone is walking around thinking this person is lying all the time. If you don't discipline them or look into it, it'll come back to bite you. And I think people know that, but it's often hard to deal with the number one producer. So let's dig into this training conundrum. I'm going to use an example that applies primarily with physicians, but it's only an example and you can see it in any situation. So what do you tell people about missing documentation? Regular listeners know I say that if it isn't written, it isn't done, is not the law. It's a myth, right? And that documentation isn't the real test. But you want your physicians to document properly, right? So there's a problem. If you go in and in compliance, folks will often say, David, don't tell our doctors about this law because then they won't document, right? And there's our conundrum. Well, I am going to cite to the clash. Don't train in vain. And I wish Catherine London were here right now because this is, of course, from London Calling, the album. And so our colleague, Catherine London, if she were calling right now from the album Train in Vain, we're going too far down this rabbit hole. But avoid the clash. Do not exaggerate as part of your training. Gary Larson sums this up really well. Uh-oh, Danny. Sounds like the monster's in the basement. Heard you crying again. Let's be real quiet and hope he goes away. Whether you're parenting or working in compliance, trying to use fear as a motivation backfires because you wind up telling people that things are illegal when they're not. And then they see behavior that you've told them is illegal and they bring a whistleblower suit and you wind up defending yourself against illegal activity. Now, so what do you tell physicians about documentation? You say, hey, look, the law doesn't require you for Medicare to document perfectly. Medicaid, different story in many states, but in private payers, it's going to vary. But for Medicare, you don't explicitly need to document. But if we get audited, we have to prove we did the work. And the only easy way to do that is with the documentation. So we have a corporate policy that requires you to document. And if you don't follow our corporate policy, we're going to fire you. Your corporate policy can be more restrictive than the law. That's fine. Just explain that in the corporate policy and recognize that you're not firing them for breaking the law. You're firing them for making your life difficult and not following the rules. And I don't think that it's that difficult to draw that nuance. But that nuance can save you a lot of money. I would have a hard time naming an investigation where we haven't had at least one email or PowerPoint presentation that overstated the law and that the government seized upon to say, see, you knew you had improper intent. You knew what you were doing was wrong, where in fact, the problem was the law was characterized inaccurately. Obviously, you want to track training efforts. You want to make sure employees aren't taking risks for reimbursement. The first compliance thing I ever worked on was 25 years ago, like almost this week. I was a baby lawyer, and coders intentionally moved every level of service up one notch because they thought Medicare's reimbursement was really crummy. So they made all the 3s, 4s, and 4s, 5s, and 5s, I don't know, prolonged visits. And they thought they were helping, right? They were improving the clinic's performance. And you need to squish that, and you need to explain to people that if their supervisor is making them uncomfortable, they should feel comfortable talking to the supervisor, or if they don't, they need to know how to use the hotline and where to go. Here's one of the compliance conundrums. Do you tell your internal people that if they're having problems with a supervisor, that they should keep contemporaneous documentation of those problems? Here are the pros and the cons, right? In some ways, you're helping turn them into employment law plaintiffs, right? Keep good records so you can bring a claim. But on the other hand, you're setting it up so that if you get into a he said, she said, where one of your employees is saying, I've had issues with the boss, you're better equipped to evaluate who's telling the truth. And I don't know if I'm naive, but I kind of like knowing the truth in here. And so personally, I err towards taking the risk that you are helping people create a better paper trail and saying that better paper trail makes you better equipped to figure out what's really going on. So that's a Glaser opinion, not the law, and I am sure some people will disagree with me. But some of that is a belief of mine. I prefer to get in trouble for things I've done, not for things I didn't do. So you have to decide which way you come down on that. But the other theme is there's a difference between a mistake and fraud. That line is viewed differently by the government. You know, the government has often said false claims cases aren't on mistakes, they're only about fraud. They will then characterize misunderstanding a code as fraud, where I was characterized that as a mistake. The fuel light's on, Frank, we're all going to die, we're all going to die. Oh, wait, that's my mistake, that's the intercom light, right? Don't, make sure you know what you're talking about before you do it. This happened on a British Airways jet, and I love the little expressions the people in the back of that Gary Larson plane. So is your compliance plan just for billing? So the sentencing guidelines, which is the root cause of all compliance plans, the reason compliance plans exist is that if you have one and you're convicted of a crime and sentenced, you get a lower penalty if you have a compliance plan. So you'd say, well, it's only criminal stuff. But I don't think that's why you do a compliance plan. I think you do a compliance plan to stay off of TV. And so I would err on the side of doing it, of going broadly. Your reputation is what you're trying to protect. So Gary Larson summed this one up really well. Cat chasing, garden digging, and garbage dumping. This is one of my favorite Gary Larson cartoons of all time, even if it's gross, or it's the closest to obscene I get. If you would all examine the chart, you'll notice that, well, it seems that Mr. Sparky has found something more engrossing than this meeting. So Mr. Sparky in the lower left corner is sniffing his crotch. So why do I put a crotch sniffing dog in a presentation? Because sexual harassment, antitrust concerns, dumping medical waste in the back, they're all a big deal. They'll all get you on TV. And for that reason, they should all be part of compliance. I think what you're really saying is if something bothers you, call. And yes, most of your calls will be about HR complaints. But that's okay. You'll have to separate some wheat for chaff, but I would rather have more stuff come in. So another element of the compliance plans is that you have to monitor and audit compliance. And they use the word audit, as we'll talk about. I'm not super fond of that word. When you do this, choose your words carefully. I can't tell you how often I see a memo start, this is fraudulent, or you're missing documentation, which is Medicare fraud, or something like that. And it doesn't help at all to have something labeled as fraud internally. So if you're going to have a written report of a review, and sometimes it's better not to, just keep it factual and avoid characterizations. You have to decide if people will listen to the internal reviewers. You often need to get external reviewers to have your message listened to. The whole Pro from Dover syndrome is a mystery to me. I see it in our firm, right? People who are considered international experts, when they talk within the firm, are considered goofs. And I'm sure that happens every place. If you need to get an external review to convince people what's going on, get that external review. I'm a fan of having an external review periodically, just so that you know you're not being too conservative or too liberal. As you do part of the review, it's also just sometimes people choose the easiest things to review. They choose what's in front of them, and you got to make sure you get the hard stuff too. I am not worried about whether you do a statistically valid review. In fact, I kind of prefer that you don't. Now, you're not going to see people recommend using addictive drugs to your advantage very often. This may be one of the few times you'll hear that from your lawyer. And no, this isn't an opiate joke or anything like that, because I wouldn't joke about that. This is coffee. The best compliance, well, it shouldn't go with the most superlative. One of the best compliance officers I've ever worked with really impressed me. She was a prodigious buyer of coffee. So she would take people out and get them talking. And this did two things. First, in those conversations, she learned what the real problems were. But second, she got people to trust her. So we got to a point where one of those people believed that there was a giant problem in the organization. She was wrong, but she thought it was a really big deal. And the compliance officer could talk her down. And she could talk her down because of all that coffee. That sounds almost ironic, right? All the coffee really would have hyped her up. But it was the relationship built over the coffee. And that's where I'm back to, it's not the paper that matters. This is all about human interaction. The other thing is knowing people are scared to talk. Being the squeaky wheel is terrifying, right? Everyone is afraid that if they complain, whether it's complaining about a boss or just saying we think we're doing this wrong, they're afraid they're going to get fired. And so a lot of work has to go into saying, no, not only will you not be fired, we'll be lauded. And, you know, there's the expression, even a stopped clock is right twice a day. The people who bring stuff up are often, how do I put this politely, not necessarily the most socially normative folks. Sometimes your biggest complainers are people who are a little bit outside of the social norm, right? Partially because complaining doesn't go over very well, and it can become easy to dismiss people. We've got, I'm sure, at least a dozen cases we've had where the person who complained had complained a dozen times before, and the first 12 times were nothing, but this one, they're right. And so you have to have people, A, comfortable they won't be retaliated against, and B, even if they've, basically, if you now don't trust the person's complaints, you've got to fire them. Don't keep someone around who keeps complaining and who you're going to dismiss out of hand, because that's a disaster. Either fire them or listen to them. All right, now it's time to talk about the funnel conundrum. And no, that is not this, which is, so I went to see the eclipse. As an aside, if you get a chance to go see the big eclipse in 2024, the next one, you gotta go. We drove down to Jefferson City, Missouri. We spent 16 hours in the car that day, and every family member of mine said they'd do it again. That's neither here nor there. On the way back, looking up through the sunroof in our car, we saw that. And if you're wondering what that little curly Q is, that's like the beginning of a tornado. That is something you do not want to look up out of your car and see unless you're a storm chaser. And while I still don't like looking up at it. I want to be chasing it, not under it. There was no tornado warning for this thing or anything like that. It did not, in fact, drop a tornado, but it was trying right there. And while I'm on funnel conundrums, here's a Gary Larson that I had never seen before. But it's up my alley. So what is the funnel conundrum? Do you want a broad funnel or a narrow funnel? And the problem is, if it's broad, the risk of something falling through the cracks increases. The more places someone can bring something in, the more likely they are to report it and you never hear it again. The problem with narrow is it just makes it less likely someone brings it forward. And this one really is a conundrum. There is not a right answer to this. My strong instinct is broad, and I recognize the risk that things will fall through the cracks. The way I recommend approaching that is training people to say, if you don't get an answer to your concern, ask again. And I think that then allows you to have the broad thing with people saying, hey, wait, I didn't hear anything. So one strategy I like using a free email. Get a Gmail account so that someone can email the compliance officer if they want anonymity. Ideally, people don't care about anonymity, right? Ideally, they'll just walk in. But for that person who wants anonymity, this is a mechanism that allows them to raise a concern and engage in a dialogue with you without them identifying themselves. But you can go back and forth because they've got this email account that they've set up anonymously. The biggest problem with that is the first time you get an email, this is almost embarrassing, I shouldn't tell this, but like the firm set up a disaster recovery thing. The first email we got from the disaster recovery people went into our spam filter, right? Because it didn't get set up to go, it wasn't put on the whitelist. There's a lesson, everyone listen to this and kind of think, what do we have on our whitelist? Spam filters are a problem, and they can screw up your compliance things because you could get a compliance email that goes into a spam filter, right? But if people are expecting an answer, they'll try again. So I encourage people to have a hierarchy of go to your supervisor, then the compliance officer, and then your corporate counsel as the way of dealing with this. We have a free semi-annual certification form. It's really simple. If you'd like to see it, if you send me an email, I'll shoot it to you. And it just asks people to report concerns they've got. Very simple, very easy, one page. I'd send it to people at least twice a year, maybe quarterly. Why? When someone reports a concern, they say, I've been asking about this for years. If you've got a form from them where they check the box and say, nope, I don't have any compliance concerns, it at least gets you out of the argument that you've been ignoring this person as they raise the concerns. Now, obviously, if you go get these forms from everyone, you're going to have to deal with all the issues they identify. But People often think that they've raised issues more than they have, and the government tends to believe them over you. And this gives you a paper trail to say, hey, we've been asking people to identify problems. They didn't identify this one. Exit interviews are a great place to get compliance information because people who are on their way out the door tend to be honest. So ask them to give you the dirt. The next element of compliance plans is you need to have effective discipline. He's using blanks, pass it on, doesn't work. Not going to spend long on this, except to say you're supposed to, in theory, discipline people who failed to detect an offense. When my wife gave me some, she's a psychologist, she gave me some psychological testing. I come out to be a field marshal. This is kind of embarrassing. One of the traits of a field marshal is they do not like repetition of error, which is true. I don't mind when someone screws up. I don't like the same mistake twice. And I think that that's a good principle in compliance. As illustrated by Gary Larson here. Late again, this had better be good. If this is the first time Mr. Bear has made this mistake, and I'm totally sexist, right? I'm assuming that the tagged bear is Mr. Bear, and that's Mrs. Bear in there, and that's completely sexist of me, and I apologize. If it's the first time, I am sympathetic to the plight of number 8. If it's the 7th time, I am not sympathetic to the plight of number 8, and number 8 should be in big trouble. When it comes to discipline, discipline does not mean fire. Discipline means educate more often than not. You might have to fire if someone doesn't get the message, but you're building up to that just like you would in peer review. It's all about education. Just a quick thought on getting advice. Getting advice is hard. When you do it, you have to disclose all of the relevant facts. I am not a fan of calling the government when you don't know the answer to a question. Sometimes you need to, but I'm much more a fan of calling legal counsel because for 2 reasons. First, I think the government gets stuff wrong sometimes. True story, you call the GAO accounting office, the GAO accounting office did this. They called the DME supplier to ask about power wheelchairs and when you can get a power wheelchair, and you can get a power wheelchair if you lack sufficient trunk strength. Well, when the GAO called and asked what it meant to lack sufficient trunk strength, the DMERC person said, it depends on the size of the trunk of your car. If the trunk is big enough to take a wheelchair, you can get a power wheelchair. If not, you can't. I am not making that up. It's in the actual GAO report, and it's why one of the reasons I don't think that you just call the government, right? But the other reason is that you're going to have to disclose all of the relevant facts, and that means you may be incriminating yourself. So if you do ask someone, make sure that you can prove you asked it by sending them a certified letter that with you get the answer. You answer the question and send them the answer and say, this is my understanding of the answer, and you're set up. But you don't want to be in the situation where we know we were, whoa, our dorsal fins are sticking out. I wonder how many times that screwed things up. If you go to the government asking them a question, they can use that question against you. All right, so what's wrong with this slide? So in my mind, and this one is, while targeted towards physicians, we've got some medical device people on here, we've got insurance companies listening. You can learn the lesson in here. There are 2 things I hate. Something went wrong there. Something did not go wrong. I'll come back to that in a moment. First, this is just the law that if it isn't written, it wasn't done. You can read that on your own. I'm not going through it. Here's what's wrong with the slide. I don't like the word audit. I think for most of what we're doing, it's not scientific enough to be an audit, and calling something an audit gives the government the reason to believe that it's more scientific than it is. Overcoded and undercoded are conclusory, and they set people up to think you have a problem. You only know when you've looked at documentation whether something was documented correctly or not. It could have been documented correctly or documented and not done and not documented. Choose your words properly. So whatever sort of review you're doing, if you're in the DME world and you're looking to see if something was supplied and you're missing documentation, you don't know that it wasn't supplied, you just know you don't have the documentation. So you got to choose your words carefully. You also need to be super cynical. So this is a true story. One of our clients, with a smart administrator, that a patient calls and says, hey, I saw the very productive president of your group. That wasn't how she identified him. I was billed for a complete physical, but I didn't take off any clothes. So what would you do? You'd presumably look at the medical record, right? My client did that and found things were completely documented. If I had been my client, I might have quit there, because we're back to the woman's probably crazy, right? There's an exam here. Well, my client was smarter than me and had had a receptionist who had said, I'm worried about Dr. X. I think Dr. X is exaggerating. So the administrator pulled the doctor's appointment book, which showed the doctor scheduled 9 to 3, took lunch, saw 67 patients, 6 of them had 99215s. There was great documentation. But what turned out was happening is that the doctor was using an exam template and recording exams that weren't happening. Really hard to detect that. Really hard. Basically, it was the patient complaint that got us there. And the lesson is, A, you got to listen to patient complaints, and B, you've got to be skeptical. Even you want to find that everything's okay, right? So when you find the documentation, that could give you reason to close things. You have to keep asking that question of, jeepers, is this really there? Now, practical educational question that comes up. You found a problem. How do you educate people? I was working with a doctor in Michigan, and the doctor in Michigan got a letter from Medicare. They had looked at 20 charts. They found an overpayment of $2,000. He was thrilled, right? Because he had flunked on 19 of 20 charts, but they didn't project to a larger universe. So it was pittance to him. He was making over $1 million a year. He didn't care about $2,000. But if they had projected that 19 of 20 to his full universe, it would have been bad. And he didn't get that message. Sometimes you need to deliver that message. So how do you do that? So first, if you quantify exposure, you got to use your language by explaining what you're doing, right? Again, in a way that it doesn't come back to bite you, and that can be difficult. Steal this language if you're doing E&M reviews. Explain that you're just looking at the documentation. It's not statistically valid, and you don't know what was actually done. You can read these slides. Pull this right out if you're a hospital or clinic looking at E&M reviews, but just know how you sound. Another true story. When I was a baby lawyer, I worked with a hospital that was doing dialysis. And dialysis stations are credentialed by Medicare. So they had 10 stations. They had 22 patients who needed dialysis. So they were running 10 stations for one shift, 10 for another. That took care of 20. That left them with 2 more people who needed it. Now, the proper thing they could have done is they could have run a 3rd shift. But in dialysis 8 hours, they would have had to do it all night. That was a pain in the butt. So they just threw up 1 more station and did it. Okay? That was their solution to the problem. That station wasn't certified by Medicare. Everyone there kind of knew it was a problem. They talked to the nurse manager, and the nurse manager said this isn't a big deal. Now, this was a long time ago. The organization didn't have a compliance plan in place. If they had, maybe someone would have called, but I don't know, because their boss was saying it's okay. And that is often the barrier to success, is you need a boss, people to question their boss. Now, as an aside, just on how that story ended, it turns out I would argue that that was a violation of the conditions of participation and not payment. We didn't have that wording back in that day. It was the argument we came up with before we know that that was the argument. The government bought the argument, but said, if you make that argument, David, we're going to audit every single thing we can in that hospital. And so the hospital decided to pony up the money. But the real story in there is beware of the mid-level person. Also beware of the fact that when you get information from a trade group, sometimes they have an agenda. You know, don't be afraid, Doug. Me, teach him to sit on finger. Doug, closer, closer. So if you look at the guy there, he can let the pterodactyl land on him. It's not going to bother him. Trade groups, I've seen a trade group for nurse practitioners and physician assistants say that you are required to let the to have the MD, I'm sorry, let's try it again, the NP or PA bill independently, because they thought it was advocating for professional independence. So they mischaracterized the law to advance the cause of their people. And I think you always have to be careful if you're getting advice from really anyone, that they're not just advancing their own cause. Okay, last element of a compliance plan is you have to have refunds of overpayments. Well, heaven knows what it is or where it came from. Just save it, or just get rid of it, but save that cheese first. Our lawyer job is to help you decide if it's really an overpayment. We talked about this at the beginning, so I'm not going to spend too long on this, but we love getting you out of possible overpayments. You know, Not every time you have an under documentation thing is it an overpayment. Just because you violated the condition of participation, you might not have an overpayment. You bill in the name of the wrong doctor. Those are all real world situations where you kind of, quote, broken a rule, unquote, but don't need to refund. The 60-day rule does require you to go back. This isn't about the 60-day rule. We have a whole webinar on that. I stuck the statute in here. Just know that you have to go within 60 days of identification. That 60 days of identification is quantification, but an overpayment is only money that you've received that after applicable reconciliation, you're not entitled to, and it has to be an overpayment. This is a really important point because there are a whole bunch of errors that aren't overpayments. First of all, you've got an unsigned note. That isn't an overpayment, okay? That we could do a whole thing on that, but we'll just kind of move on. Also, just note, there are time limits on the recovery of overpayments, and I would argue that if 48 months have elapsed, the money you've got is no longer an overpayment in most situations, and you don't need to refund it, all right? So if you've got an overpayment and you're going back more than 48 months, you might want to talk with someone here before you do that. I know the 60-day rule says you got to go back 6 years, but there's real question about whether that 6-year provision is consistent with the law. In fact, I would go further. I would say it is not consistent with the law. So it's aspirational by the government, and you may choose to comply with it to avoid a fight, but I don't think you have to, and call one of us for more detail. All right, we're going to kind of close this off by looking at communication from the government and talk about that situation at the University of Utah and other stuff, and then we'll answer all of your questions. So you need to train people to be ready for getting a letter from Medicare, right? Something that looks like if you're getting denials, that's a big deal. If you're getting overpayment letters, it's a big deal. We've talked about the importance of reading bulletins. There is no such thing as a routine audit. It's routine to the auditors, not to you. I've been using this example for a long time. If you've heard it, zone out for 30 seconds. If you look in the upper left here, that thing that looks like a football helmet is actually a bird. And birds are bad. Birds, I mean, I feed the birds. I love birds. That sounded almost, the way I said that sounded Trumpian to me. I don't know, but I love birds. This letter went out to a bunch of clients, and it looks just sort of like a little friendly survey, right? Your response is going to be helpful to us in determining whether our dollars were properly spent. The survey involved automated hemogram indices, and the machine that did these was being pitched by a company that sold them as a mechanism to do these new lab tests and bill for them. Another side, if someone who's selling you something is giving you advice about reimbursement, take it with a slight grain of salt. Now, to be clear, I give advice on behalf of device companies about reimbursement, right? There are big device companies that give really good advice. I've seen Medtronic give really helpful advice about how to bill. It is not never listen to a device company when they give advice about billing. It's just remember where their bread is buttered, and that there are some places that play fast and loose with it. I once saw a letter from someone's, quote, legal department that said it was okay for them to give you a kickback as long as you use the kickback to benefit patients, right? They didn't word it quite that way, but that was the gist of it. Well, this survey asked a bunch of questions, and I'm going to skip ahead actually to the last question. If you received the automated indices, were they useful to you in the treatment of the Medicare patient? And I worked with a bunch of doctors who checked the box, no, they weren't. Did those doctors just admit submitting false claims? Now, I can come up with an argument that they didn't. And the argument was that the question is in hindsight. When they ordered the test, they thought it would be useful. It turns out it wasn't. That wouldn't be a false claim. The problem with that argument is, while it might be creative, it isn't consistent with the facts, which is the doctors didn't, in fact, know what these indices even were, and they didn't know how to read them. I think if the doctors checked no without knowing how to read these things, they are sending a thing back to the OIG saying that they've committed a false claim. Here's the scary thing. In a bunch of practices, the doctor filled this out. Actually, in some bunch of practices, the receptionist filled this out because it was a survey. They didn't talk to anyone. In some practices, the doctor filled it out and didn't talk to anyone. Sometimes it got to the administrator. And then sometimes it got to me. And if you're cunning, you're going, David, how do you know about the practices where the doctor filled it out? And the reason is when I started using this in speeches, people would come up to me and say, oh, we got one of those. Was it a big deal? Well, as illustrated by Gary Larson, open the gate, it's a big wiener dog. I call that the Trojan survey. It looks innocuous, but it's not. Any communication you get from the government should scare the socks off of you. If you're getting contacted by the OIG, it's a big deal. I think most people on the Horn know that. Complaints from patients are often a sign of trouble to come, or complaints from colleagues, because they often will then turn into reports to the OIG. I don't worry about a request for one medical record. That doesn't make me nervous. And I would tell your people not to freak out. Those are just usually cert reviews and not super scary. A request for multiple medical records, you want your people bringing that to your attention when they get it. You want them to keep the envelope and a bunch of other stuff. We have a webinar on that. We'll do one of those maybe in January or February. What you're really worried about are people showing up at your home. Disclosure about this slide. I have promised my daughter that when I have a slide with a shark that says, here comes trouble, I will say that sharks are not actually trouble. She wants to be a marine biologist. She likes sharks, and she's very mad at me for equating sharks with trouble. So I apologize, Zoe, but it illustrates the point well. Any of these agencies can investigate you, and MFUCU, the Medicaid Fraud Control Unit, the Postal Inspector, they'll show up, and if the Postal Inspector's poking around, it's because of mail fraud stuff. Often the Defense Criminal Investigative Service, the DCIS, will help Medicare conduct patients. Any of these can be a big deal. And prep work is really important here. You want your employees to know who to call. That's why this is an area where you want a policy. When someone shows up with a gun, it's hard to say no to them. We have cards that will cover what you need to know if you're contacted by a government agent. We provide them in reasonable quantities to clients for free. If you want one, shoot me an email. Just put agent card or laminated card in your subject line. If you don't have these, we'll send them to you. But it will have what we're about to talk about. Your emergency plan should let people know how to contact you at odd hours, because the truth of the matter is government agents often show up at 7 o'clock at night at people's homes. Not always, as we'll talk about in a minute, but often. And remember, you can train people on this every single day, and when someone with a gun shows up, a significant percentage of the people are going to forget that training. But I think compliance training absolutely needs to include what we're about to talk about. So first, are letters. Letters are the easiest thing to deal with because you have time, right? Figure out who sent it. As we've said, a request for multiple records is more troubling. Make sure you keep a copy of everything you send. And I should say here, make sure you keep a copy of the letter and the envelope in which the letter came, because the date of the envelope matters. Sometimes the date on the letter and the postmark, they might be the worst case we've seen 59 days apart. I'm not kidding about that. One was July 15th and the other one was like September 14th. So keep all that, but also if you're sending in records, you might think, well, it's our record. We don't need to keep a copy. Why waste the paper? You do need to keep a copy. And the reason you need to keep a copy is A, you may not have sent everything in. You may think you did, but you didn't get the lab reports. You didn't get the radiology reports. Or you get a question as to whether you had the billing notes were sent or not sent. The other thing is, when you send the stuff in, there's a 20% chance it's going to get lost. So rather than having to recopy it again, just have a copy so you can do it. But then you'll also just know. So make sure that someone is keeping an exact copy with page numbers of what you sent. If you're getting a letter, I am inclined to talk with counsel. It doesn't have to be a long conversation. It might be 30 seconds, but let them know what's up. Excuse me, I've got a cold and I managed to get this far without coughing in your ear, and I apologize. This is a time to think about whether you have insurance. You may, even if you just have malpractice insurance, a lot of malpractice insurers cover some government investigations up to a $25,000 or $50,000 or $100,000 amount. In fact, one way you can figure out if your counsel do this a lot or not is if one of their first questions when you get in an investigation is check for insurance coverage, because that should be one of your first questions. Telephone calls are a little scarier, right? For a few reasons. So what do you do? First, you get their name and you find out what they're calling about. But this raises an interesting question. Now, wait here. How are we supposed to know you're the real angel of death? Gary Larson is such a weird man, and I love him. When someone is calling you, how do you know that they're who they say they are? You don't. And at least 2 people on this webinar have had people purport to be government agents that were not. So we know this happens because it's happened to our clients. So you got to check. And if someone's calling you, it's hard to check, right? You can't say, give me your number and call them back, because we actually once had a nanny apply to us, and I am quite certain that she gave me a friend's number as a former employer as a reference. The only way you can find out for real is to find out what agency this person is with and then call the agency and ask for the person. That's an identity check. And I would not give anyone anything over the phone who, unless you have dealt with them before and you know who they are and recognize their voice. In any other situation, you need to verify that they're not pranking you, phishing you, whatever, right? Agents do sometimes call, it's less likely. This subpoena, I got a call from a doctor who said, David, I'm out of town on the date that this subpoena is due. It's probably some malpractice thing. Can you deal with it? It wasn't a malpractice thing. People don't always read stuff carefully. It was a grand jury subpoena from the U.S. Attorney's Office in Atlanta. Thank goodness he hadn't read it carefully, because it said, don't disclose the existence of the subpoena. Any disclosure would impede the investigation being conducted and thereby interfere with the enforcement of the law. Had he read this, he might have thought he couldn't tell me about the subpoena. Fortunately, he didn't read it, but your people might read something like this, and this is why the training is really important. You need to explain to people up front that they don't have to do, that they can always tell you, well, let's start this again. They can always contact legal counsel and talk about being contacted. In fact, the only time you can't do a contact is there are certain terrorism investigations where they can keep people quiet and certain banking investigations. There is not a mechanism to do a secret health fraud investigation that I know of. So they can't keep you from talking about it. But if you haven't, and even if you've inoculated people ahead of time on that, they'll struggle with following it. But if you don't get to them first, they will listen to whoever said you can't tell someone because that person's got a gun. So you've really got to drive that home. Now, armed agents at the door. This one's really tough. And let me give you another story from another listener. The DME validation surveyor shows up, right? Not an armed agent, but a DME validation surveyor comes. They've sent a couple of emails. The emails had typos in them. They were supposed to produce ID. They didn't have it. Client sends DME validation surveyor away. They lose their DME number. We appeal. At the first level of appeal, we're told, yes, it's true that the rules require the person to present ID, and it's true they didn't, but the burden was on the clinic to pick up the phone and call and make sure that the person was real, and they should have done that. Now, the clinic chose not to go to the next level of appeal. I think if we had gone to the next level of appeal, which would have been district court, a judge would have said, yeah, no way. I'm pretty convinced of that, and they didn't go there. But they lost their DME number for a year for sending away someone because they didn't have the right ID. And this highlights the dilemma, and we're now going to talk about the University of Utah and other stuff. It's really hard. You're walking a fine line dealing with agents, right? If they have a warrant, they get in. That's pretty rare. How do you know if it's a warrant? Well, if it says anything that isn't search warrant, it's not. Subpoena ducis tecum, civil investigative demand, note from my mother, none of those are a search warrant, all right? If it isn't a search warrant, they're not entitled to anything immediately. The Medicare statute gives them the right to immediate access to medical records, but then defines immediate access as within 24 hours. So there's no time really, absent a search warrant, where there isn't time to contact counsel and figure out what's going on. So you don't talk to the agent, really. I mean, I'm not saying you don't say anything, but don't get into the substance. You get an ID and call a lawyer. they're going to take the beware of dog sign, replace it with the dog okay, and say this isn't a big deal. Now, I want to talk for a moment about Alex Wubbles at the University of Utah, who is kind of my hero. So agents show up. They're trying to take blood from a person who had been in a car accident. The police were chasing someone. That someone drove into a truck. This is the truck driver who was struck by the fleeing felon. And he is now unconscious and in the hospital, and the police want to come draw his blood. They don't have a warrant, which they're supposed to have. And so she is looking at a policy and saying, I don't think you can do this. And the cops are insisting that they can. And then if you haven't seen this video, and I should have put a link in here, there's a long version and a short version. The video, it's disturbing to watch. They arrest her. It's contentious. The cops were totally in the wrong on this. Now, I've talked to one lawyer who said, hey, I would say that's up to the cops, right? The cops were actually going to draw the blood themselves. They weren't asking the hospital to do it. You shouldn't interfere with them coming in. That's an interesting point. I still think the patient is unconscious, and I think the hospital has a duty to protect the rights of that patient. But it's an interesting thing. The key things here, there was a policy in place. She knew where to find him. She found him. They got on the horn with their privacy officer, and she made an important decision, which is there are some things you can't undo, right? And so I think when you're in a tense situation like this, it's often good to think of which is the irreversible harm. If a patient is dying, generally I'm going to err on the side of saving their life and sorting out the legal issues later, right? If someone wants documents, if they're not supposed to get the documents, you can't get them back, right? The error, the irreversible error is turning the stuff over. So here, the error would, the blood alcohol level could change over time, but not in 5 minutes, right? We're not dealing with something that isn't allowing legal counsel to get involved. Take the time to do that. So she was trained. Now, there are a couple of things I think could have been done differently. One, I don't know if anyone got on the horn to the general counsel's office. It's possible they did. I just don't know. I would do that because sometimes a lawyer here could help. Videoing the encounter. Now, this is an unfair expectation, right? It starts off with a normal conversation with the police. No one thought it was going to go into crazy land. I don't think you video every encounter with the police, although maybe you should. Note, officers will often say you are not supposed to film them. That is wrong, period. I was mentioning Kevin Rich just won a Supreme Court case. He also had a case involving a client who was filming an accident scene, and they tried to arrest the person. You can film in public. It's just okay, right? If you can see it with your eyes, you can see it with a camera. That's like First Amendment land. But all kinds of cops get mad at you about that. There are apps that you can put on your phone. The ACLU has an app, mobile arrest. I've got it on my phone. I'll look for it in a second here. And you can put that on your phone. And if you film with it, it uploads automatically when you, mobile justice, that's the term of it. So you can Google mobile justice and put it on your phone. It automatically uploads in case they keep going. And I know we're going a minute over, we won't go much further, and we've got our questions, which we'll get to in a second. So, agents love to get you talking, and your best weapon is silence, right? They will often people want to say, oh, my lawyer said this was okay. A doctor in Michigan did that. That was waiver of the attorney-client privilege. One of our clients said, oh, are you here because of the X? The agent said, no, we're not, but why don't we talk about that? Nothing good can come out of that conversation. You almost always wind up cooperating with the government, but you don't decide that in the first 5 minutes. And you do it over time, and often with you want witnesses there like your lawyer. It's just not something you do right away. And people worry, well, won't they get mad at me? Well, imagine that the government agent is the shark in this thing. And the shark says, hey, I want you to talk, i.e. jump in the water. You have a choice. You can have happy sharks or you can have mad sharks. I know which one I'd choose. It is often all a misunderstanding, but it's hard to win that on the first day. So this isn't the time to try. I would guess that over 95% of the investigations that we've worked on and with our clients not paying a penny. It may be more. Sometimes has nothing to do with us, right? Sometimes the government just closes the investigation on its own, and we'd love to claim credit for it, but we can't. I will say, and I think that there are times we've gotten investigations to go away where others pay. I mean, the highlight as a lawyer is when 150 hospitals pay and yours doesn't, right? And we've got some of those. But the bottom line is the fact that you've got investigators there doesn't mean money is going to change hands. I would say over 95% of the time for our clients, it doesn't. But it might take 7 years to get there, right? The agent can't make anyone attend an interview, put an asterisk there. The boards of medicine, licensing boards generally can make licensees attend an interview. So that you kind of have to have an asterisk for that. But like the FBI and OIG generally can't. Well, then actually, we have to put a little asterisk there too. There is a mechanism where they can go off and get a subpoena for a deposition, but they can't make you just show up without that subpoena. They can't get documents without a warrant or a subpoena. They can't get privileged information, and as we've covered, they can't prevent you from talking about things. You can't prevent people from talking to the government, and this is a big deal. I've only had one client go to the big house. He was being investigated for a teaching physician issue. We got him out of that. What ultimately got him in trouble was the day before a meeting with investigators, everyone sat down to what they would say is make sure they had the facts right. What the government would say was obstruct justice by coming up with a story together, which highlights how perilous this can be. Just conversations internally about what is going on can lead to an obstruction situation. And so training people on this is really a big deal. If you talk, you have to tell the truth because lying to a government agent is a crime, and then never destroy or hide documents. That makes you famous, right? People who know who Fawn Hall is know her for only one reason, and that's smuggling documents out in her bra. Which monster did this? Godzilla, Gargantua, who? I am happy to say most cops are, and the agents I work with have generally been way smarter than this, and I am thankful for that. I always like working with smart government lawyers and smart government agents, and they usually are, and that means you usually get to the right place. Coming back from the eclipse, we also saw this, which it was a major sky thing, eclipse, rainbow, and near tornado. Now, let's go to the questions. So let's see what we got. And that rainbow is because I believe things usually work out in the end, right? That's where we're back. Most people don't pay. All right. David, I want others in the clinic to watch this. Will this be available? First, I pity anyone who watches this, but yes, all of our past webinars are, well, this one, it'll probably go up in 2 days or so, like by the end of the weekish. And our past ones are on our website, the same area where you register, you can see past webinars. Clearly your answer, let's see, is coming from a lawyer and why compliance departments shouldn't be in the law department. Well, I mean, I have a bias on this one. Actually, I think compliance and law need to work closely together. I do feel really strongly on that. Each need the other. Compliance can't function without knowing what the law is, and law is a heck of a lot less valuable if we don't have compliance people working with us. Pair them up. Okay, so we're receiving requests from physician office records from MCR Advantage auditors. Is this a problem? Well, it depends on how you define problem, right? You don't know, right? I guess is the short answer. It's not the same as getting stuff from the government. You don't know what they're going to do with them, and there's always a difficult question of how much work do you do while waiting for the results of an audit? And reasonable people could differ. I increasingly am a fan of waiting to see what they say, and then dealing with it if they come back with a problem. Reasonable people could differ with that. The reason I come down that way is if you do your own looking, you'll then have to decide, are you going to refund or not? And you're going to pay money to review a bunch of stuff that's probably okay, but that's an excellent question. And if you want, shoot me an email and we can talk more about it. I think I'd change my answer a little based on what they're asking and what's going on. Is there a law that states you can't code accounts without the history and physical or dictate a discharge summary form? I've coded at many places, and some companies require the coder to wait for this documentation, and some allow their coders to code the account without it. Well, okay, this is a great question. So I don't know of any law that requires, this is the classic example in my mind of things that are policy and not law. Now, there's the Medicare answer and Medicaid. In some states, Medicaid would say you shouldn't bill for things you don't have documentation for. As we've discussed, Medicare, that is not true. And so if you don't have to have documentation ever, you certainly don't have to have documentation before you bill. But some state Medicaid programs may say, as a condition of billing, you're promising that you've got documentation. Okay, given that Medicare Part C and Part D providers must complete CMS-required fraud, waste, and abuse and compliance educational module, how do we avoid having the CMS standards which may not be supported by law? Oh, this is a great question. And holy cow. So first, we've done some stuff about that fraud, waste, and abuse training. And I would say, just as an aside first, that fraud, waste, and abuse training is not required by law. What it is probably required by is your contract with the Part C or Part D insurer. It's interesting, and we could get into this, but the law applies to the insurers. It does not apply to any of the healthcare organizations listening to this. Then the insurers impose that on you through the contract. If you stand up in the contract, you don't have to do this. Now, that's not going to be easy for most people to do, but if you're big enough to have the pushback to say, no, we're not going to make all of our people watch that stupid 70 slide thing, you could do that and you wouldn't be breaking a law. Otherwise, if you agree to do it in the contract, I don't have a magic answer, but then the other thing is try to limit who has to watch the training because, oh my God, it's brutal. And so and there are some places that say everyone who's involved in billing, which would in theory include every healthcare professional, has to watch it. And oh, that's such a waste. Last question. I see for clinical research billing, we're told to follow Medicare rules and that we can't give a better deal to non-Medicare insurers than what Medicare beneficiaries would receive. For example, if Medicare pays for a procedure, we're told we can't bill the research sponsor for the patient with the private insurer without doing the same for the Medicare patient. There's a lot going on here. I will say this, and this is another one. We have a frequently asked questions webinar, and we cover that one in there, and we'll do it again soon, but I'll answer it now. Medicare is not entitled to your lowest price. People often think they are, but that's a myth. Now, it gets a little more complicated in the research realm, but just because Medicare pays for something doesn't mean you have to handle it the same way in all contexts. Now, in the research thing, you get into what's your deal with the research. Boy, I'm going to have a hard time. I'm slurring my words. Maybe it's the cold medication. You got to know what deal you've worked out with the research sponsor and the like. You may have promised them that that's what you do. And if that's what you've promised them, it's what you're stuck with. But legally, you can handle Medicare and other patients differently. I see one more question coming in. We're at the end. Let's just see here. Our office switched billing companies. With the new billing company, we're always fighting over codes, which we didn't with the old company. Do you have any recommendations over what to do? That's a great question, too. So, boy, maybe we're due for just another question webinar. Maybe we'll do one of those in January or February. You have to figure out who's right. So first, the billing company works for you. I just helped a client with this, where the billing company said, we won't send anything in if it's not signed. And I'm like, it doesn't have to be signed. That's a risk management question, right? Better if it's signed, but the risk falls on my client, not the billing company. And I don't understand. I would never say to my client, I'm only going to say to my client, I won't do this for you if I thought I was committing a felony, right? You're the boss. You get to decide how you run stuff. I work and serve at your pleasure. And it is really weird for me when a billing company says, we won't do what you tell us to do. And I guess they're worried about liability, but if you tell them this is how we want you to do it, that liability is on you, not them. Billing companies don't get in trouble when they do what you tell them to do. And I wouldn't work with a billing company that was that difficult. But the billing, you want to make sure first that the billing company is wrong. And so my advice would be confirm that the new billing company is wrong. And if they're wrong, fire them. All right. I think we'll have a few things that we can always follow up in emails. We did run a little over. I apologize for that. Remember, next month will be Health Law 101. So if you've got new lawyers who would, or anyone else that would benefit from that, sign them up. After that, we'll do HIPAA November 8th. And as always, you can call anyone in our group. We love talking to you with questions. Drop me an email. And if you want the agent cards, just put cards or agent cards in the subject line and send me an email. Have a great day, and we'll talk to you soon.